The transplant process begins long before the actual transplant operation. As I just showed you here, we get the phone calls saying there's a donor somewhere. It could be here in the state of South Carolina. It could be anywhere within 500 miles, perhaps. And once the person on call does the evaluation online, we often talk between Dr. Paletti, Dr. Whalen, and myself to decide if this donor really is an appropriate donor for our potential recipient. And then we collectively make the decision that yes, we'll do the transplant, or at least go there to evaluate, or no, we'll decline. And then beyond that, there's a very lengthy period of waiting, I would say 4 to 6 hours. And that time is also very variable. And in that time period, we make the phone calls to our prospective recipient and tell them you need to hurry up and come to the hospital, only to find themselves waiting for another period of time while we coordinate with the other centers receiving organs from this same donor. And then we pick an OR time at the donor hospital that we'll all meet and do the procurements. I fly away typically with one of our fellows and also support staff from our LifePoint organ procurement organization. They arrange for the travel both in the ground and on the air. We fly out together to harvest the lungs or the heart and bring them back ourselves. Once the organs arrive here in the hospital, as you saw with Mr. Floret, they come in this ice chest, and there are several bags that are all packed sterilely at the donor hospital to make sure the lungs stay sterile throughout the entire process. The lungs are lifted from the ice chest into sterile basins on the OR back table. And when we take the lungs, they come out as a block. Like the two lungs attached together with the donor's trachea, and also part of the left atrium, the back of the donor's heart. Dividing the left atrium and dividing the airway and also the main pulmonary artery. And then we place the right and left lungs into each of their own sterile basins on ice. And typically at this point, whoever started the operation, one of my cardiac colleagues, has placed the patient on cardiopulmonary bypass and has started removing the recipient's lungs. And then I assist with the rest of the operation, removing the diseased lungs and then sewing in the donor lungs. My favorite part is coming off pump. So during the whole bypass procedure, as we take out the lungs and sew the lungs in, the patient is supported. We could take out both lungs at the same time and the patient would be just fine because the bypass machine is serving the function of the lungs and also this heart that's not really pumping blood during the operation. The true test of the operation is once we wean off the cardiopulmonary bypass. That tells us that the lungs are functioning. And it's not something we do instantaneously. We don't just flip a switch. But what we do is we turn down the flows of the bypass pump. So during the operation, the typical flow is around 5 liters of blood. That's a typical cardiac output of an adult person. And we turn the pump down halfway. So it only pumps 3 liters or 2 liters or 2.5. And what that allows the right heart to do is to pump the blood to the lungs and come back into the left side and the body. And as we do that, we watch the patient's oxygen saturations. And this is all monitored continuously throughout the entire case, but only after we start turning down the bypass pump and making the lungs do some work do we assess what their function really is. And if there's any issues, we go back and support with partial or full cardiopulmonary bypass. We spend some time looking around to make sure there's no bleeding issues from where we sewed the pulmonary artery or the pulmonary veins back together. And then after 10 or 15 minutes of stability where we've proven that these lungs are working, then we work on taking out the bypass lines for the pump. But having the ability to turn down the pump and to stand there and assure myself and everyone else in the room that these lungs are doing what they're supposed to be doing, they're oxygenating the body, that's success. And that's really what I look forward to the entire case.